then you start talking.
Hello, this is Life Improvement Hospice, educating the public about palliative care services. There's an issue that affects each and everyone on the planet Earth. That is how our life and the life of the loved ones should end in case we are suffering from chronic condition. Many times people suffering from chronic conditions are frustrated, and also the healthcare team are frustrated, reason being because cure cannot be got. But instead of being frustrated or discouraged by what you cannot do, we can focus on what we can do. Here is a message that will help the caretakers of people suffering from chronic conditions and the community at large to ensure that these relatives of ours die peacefully and comfortably. I'll be sharing video clips once in a while to empower and educate and support carers or relatives of people suffering from chronic conditions. And this kind of care that offers comfort and peace, that improves quality of life, is what we are calling palliative care. So what is palliative care? It's basically care we give to people who are suffering from life-threatening illnesses or conditions that cannot be cured. And of course, if the condition cannot be cured, that does not mean nothing cannot be done without helping these patients. At least something can be done. And what we are going to do is what we are calling palliative care. So we shall be able to treat their complaints. Besides, we shall be able to control their pain. And also, we shall not end there, not only the physical well-being. Because in the healthcare system, health workers tend to concentrate on the physical well-being of a patient. And yet, life is not all about a physical well-being. A person, an individual, is also about the mind, the emotions, the spiritual well-being, and the social welfare. So palliative care looks at a patient as a whole in those aspects. And the process of looking at a patient as a whole, psychological or emotional, spiritual, socially, and not only concentrating on the physical aspect, is what we shall again call holistic care. So in our next video clips, we shall be looking at the specific advices we can give to carers or relatives of people suffering from these chronic conditions. And before which, what are these chronic conditions? These are diseases like cancer, HIV, hypertension, diabetes, to mention but a few, which are very common in our community today. And the number of people suffering from such illnesses is on the rise. This calls for a justification as to why palliative care services are more than ever needed in this time of our living. So the fact that healthcare workers get discouraged and frustrated if a disease has no cure, palliative care takes on and says something can be done. Here are 3 statements justifying that something can still be done in palliative care services, even if the situation is hopeless in the curative world. 1, we may not be able to cure the incurable, but we can treat the distressing complaints or symptoms and make quality of life better, and a patient is comfortable and peaceful. We may also not take away the pain of the loss that the relatives or the patient losing good health is going through, but we can stand with people who are grieving, share their grievances, and comfort them. We can also not have answers to all the questions that we may be asked by these patients and their relatives, but we can listen to all the questions they may ask. And listening is a therapy. For sure, If at one point in life you have an issue and you go to a trusted friend and narrate what is hurting you, even if the friend does not give you a solution, somehow you feel better, you emptied your heart. So listening is a therapy, and if we give these people a listening ear and we listen actively, we shall be in position to have helped them or make them feel better. So palliative care concentrates on chronic pain or chronic conditions, and this kind of care, as we've said, is holistic. And we said holistic is looking at a patient as a whole, whereby you are not only concentrating on the physical well-being, but you are also helping the patient to solve their social problems, which is the issue of relationship, food, housing, finance. Also, you may be handling spiritual issues, which is question about God, question about meaning of life, whether you're at peace with God or you want people to pray for you, and so on. And what is hurting you at present, what is hurting you which already happened in the past, and what in future you plan to do to improve on your spiritual well-being. Besides, we also talked about psychological and social and emotional issues, which is to do with the mind and emotions. That is the sadness, the anxiety, how you feel bad about the condition you are having, and any other thing that is hurting you, bringing about emotional pain. Then we say the physical well-being, which most health workers in the curative world concentrate on. That is the complaints that the patient is having every day, like the headache, the pain, anything not right that can be reported that you are seeking help for. So for today, that's the opening or preamble or overview I have about palliative care with Life Improvement Hospice. See you next time. Yeah. So this is Life Improvement Hospice, still giving education about care services to patients and their relatives who are suffering from chronic conditions. Having seen the previous video clips, an overview of what palliative care is, the next time we meet, I'll be talking about the non-medical remedies or non-drug measures or non-pharmacological measures we use to control some of these complaints or symptoms that patients with chronic conditions will be having. For example, some of them may be having diarrhea, cough. What non-drugs measures can you use as a caretaker to support them? Thank you.